Sometimes the sciatica, as we know it, is not a diagnosis. Sciatica is a symptom. So it's like the consequence of something else. So, and as I said, 90% is.
Some of our clientele that are coming down here are an aging clientele. They're getting into their later years in life, and some of them need a doctor to oversee some of the issues that they're dealing with. And so not only do you help with the physical therapy part and the training and the wellness and stuff like that, but you can also help them with the, medical issues as well.
Yeah, by example, we can deal with infections, any kind of aches, the hormonal replacement therapy, any medical condition, we can work with it.
Can I ask you about the hormonal replacement therapy? What is that all about?
Yeah, hormonal replacement therapy is, as the word says, it's about replacing your natural function. Normally, you can lose during aging or just by having an illness. So the idea is to see how your body is now responding by practicing blood work, and then try to correct not just the dosages, the levels, to try to stabilize or rebalance your body, right, your systems.
How would somebody know if they needed hormone replacement therapy? What would be some reason why they would come in and go, "Hey, doctor, I need it"?
Yeah, it depends on the deficiencies or the gland that is affected. It causes many different symptoms, but normally we can expect that after 40 years we are lack of something, because our lifestyle is not the right one mostly all the time, and we expect to be unbalanced somewhere. So it would be great if we can practice regular blood work at least once a year, and then you can track how your hormones are in your body.
So just want to be clear for the people, some of our the people that are following us, that if they're maybe getting over their 40s, you said over 40 years old, and they're maybe experiencing, they're not feeling right, or they're starting to feel some of the effects of aging, that they can come in, have some blood work done, and then through that try to see if their body's out of balance anywhere, and then have you help them get in balance.
Yes, exactly. That's the idea. So normally we can do it clinically. During consultation, I can ask you a few things, and we can, with these answers, we can have an idea what's going on in there. But of course, we need the lab test, the blood work results, and then we can offer you a solution for that.
Is it a complicated process, the solutions?
So easy. Normally, we recommend people to use bioidentical hormones that could be delivered by using creams, gels, very practical things. We don't like to use too much orals or injectables, but if necessary, of course, we can handle it. We know how to do it.
And then, like, how long from once the therapy starts do people start seeing a difference?
So the first goal is rebalance the levels, and then establish like a maintenance dosages, and sometimes it's possible to really correct the problem and solve the problem. So, but it depends on each individual.
I'm actually just getting ready. We're going to do it together.
Okay.
So this is going to be my first time to do it with you. So I'm looking forward to seeing, how it is, how, the results that happen. I know I'm going to be going on vacation a week, and as soon as I get back, we're going to be working on not only a fitness program, a wellness program, a diet program. Actually, since I've been working with you in the last 3 weeks, I've already lost 20 pounds. So thank you very much. You've gotten my mind right and stuff like that. And then we get back, we're going to work on getting everything in balance, which is so easy in nowadays in life to be out of balance. I think that the world is constantly pushing us in directions that are trying to get us off of balance.
Yeah, especially stress.
Yeah,
stress is always hitting our brains and our neuropeptide levels, and that interferes with the whole body. So because the production of hormones are here, and it depends on our mental state, on our mood, and it depends on many things. But stress really unbalances, and sometimes just by controlling the stress factors, we can re-establish a normal hormonal cycles in the body.
And people, a lot of the clients are moving down here to get away. I mean, they've lived very stressful lifestyles. Obviously, they're coming from the United States in either busy careers and family and all the stuff, the job and everything that's going on, and they're coming down here to probably get into balance, to find some peace, to get next to the ocean, enjoy the lifestyle, right? And so through that, they can also, come and meet with you and get their body in balance too.
Yeah, and the idea is to live longer and healthier. And of course, enjoy this area because we know the people likes it. I like it. That's why I'm here. And of course, I can help people. I can help you if, to come and try to work with you close together and see what can I do for you. Okay.
Well, doctor, I want to ask you about some specific things right now, and I know you specialize because you've been working with my wife, and we brought that up last time. But you deal with back issues. People that have been, a lot of people are having back issues nowadays, right?
Yeah. So I think like 70% of my patients have back issues, backaches normally.
Right.
Yeah.
Back pain. So they're dealing with chronic back pain.
Yeah.
Right.
Chronic and acute pain.
Okay.
Normally, by example, the sciatica.
Okay.
Yeah. Sciatica is a very common problem that it's known that is a pain that goes down the leg from the low back. That's normally the definition. And
because there's that nerve that comes up, right? It's a sciatic nerve. Is that the same? Is that what's caused?
That nerve comes out from the lumbar spine, and it goes of the rear part of the leg and down till the toes. So when you got acute injured, and that spot normally it's disc hernia. 90% of sciatic problems are disc hernias, lumbar spine normally. So, but sometimes the sciatica, as we know it, is not a diagnosis. Sciatica is a symptom. So it's like the consequence of something else. So, and as I said, 90% is caused by hernias. Yeah.
Okay.
Yeah.
And how do you diagnose that? What do you have to do to figure out what the problem is?
Yeah, normally people, when they feel this kind of symptom, this kind of pain, they do not go to the doctor. They just wait till the pain disappears. And normally it takes naturally like 6 weeks to solve by itself, but 6 painful weeks. But if you come or if you go to a doctor, it will be very important to differentiate what's the cause, what kind of diagnosis you have in front of you. Because I said normally 90% are caused by disc hernias. But I've seen in my daily practice that mostly 50% of my patients with sciatic nerve pain are not caused by disc hernias.
Okay.
So this is very important.
So what would cause it?
That's why we have to do a diagnosis, because the treatment varies completely or differs completely from classic disc herniated sciatic nerve pain. So the most frequent things, the most common is the sacroiliac joint pain. The diagnosis there is called sacroiliac joint subluxation. So it causes sciatic pain, but is not the most common cause. So if we differentiate this, then we'll be able to offer or to do different stuff, to fix it.
So what would be the treatment? Is it medication or is it adjusting? I mean, what would somebody expect to do if they're dealing with this pain? What would be?
The first thing is to find the diagnosis.
Okay.
It's like when you take the car, to the mechanic,
right?
Or you can take it to AutoZone and they put the computer there. It's the same. We need to find the diagnosis, and then after the treatment, it's very easy. Normally we use medication. Actually, people can use medication that can find over the counter at the pharmacy and deal with it. If they don't have the opportunity to visit a doctor, and they can control the symptoms and not need to wait 6 weeks till the pain goes away for itself, right?
Will it always just go away by itself, or is it sometimes?
It will go away by itself. Normally, just 15% or 20% of those pains requires a surgical solution. Yeah.
Really? So is this like something that's debilitating? I mean, is it the level of pain that they're going to be feeling? Is it like something they can walk around with, or is this one of the pain that they're going to be in bed and not moving?
It depends the degree of the problem, but it can be debilitating on the worst cases. But of course, if you're in pain, you don't want to move, and then you stop moving. So your daily life activities can be very affected. And you might experience another kind of neurological symptoms like numbness, tingling, and just discomfort. But we can treat all this with, especially we need to use medication at the beginning, and the manipulation of the spine have shown to offer the best results.
So it's like an adjustment. So you give them the medication along with an adjustment will help at the beginning to make sure it heals faster.
Especially the next 15 days after the first approach, then we can exercise with the people, because that's the only solution for that, including these herniated problems, discs, or it can be the sacroiliac joint problem. We need to do medication, chiropractic adjustments, and then exercise.
And I know people that have back pains, it's really, it disrupts their lives. I mean, it's like nothing, when you don't feel good and you've got that pain, I mean, nothing feels good. You can't enjoy anything. So it completely just takes away the enjoyment of life when you've got that constant pain going on in
it's very disabling. And when you come with me, I'll try to put you back on track. And of course, my first goal is to eliminate the pain as quick as possible. So normally it takes 2 days and you're out of pain, and then you can get back to your life. So that's the idea.
What would be some practical tips for people to fix these?
Go to the doctor. That's the first thing, and try to find out what's wrong there. And practical things that you can do at home, by example, is wear a belt. Wear a belt to help your body to support the area or stabilize the joints, and that will really help you deal with the pain and help you drop the pain more than 50% just by wearing a belt.
So as soon as they start feeling the pain, they get a belt on. Will that belt help prevent it too, if they're having this happen more often?
We can use it if you had an episode in the past. Of course, it will help, especially if you're gonna lift heavy or you're gonna be very active.
Well, we got a lot of active people down here. They come down here to get, they're surfing and they're bike riding, and they're having all the fun by the beach, and they're running and jogging and climbing the hills and everything. So
so you can use it to prevent problems, but it's better after having an episode to exercise, and then your body naturally will create a belt. And no need to wear it all the time, but it's good to use it to treat the acute episode or to prevent if you had something in the past.
One of the things I think that you were talking to my wife about was that in order to prevent some of this is you got to build a foundation, which in your body is through movement and exercise, right? I think you've got a strong belief in that exercise is medicine.
Exactly. So we prescribe exercise because we believe in this. Exercise is a medicine that not just cures backaches. It cures many other health problems. So we use it to treat any condition. Okay.
Well, I think, in today's world, we're all very sedentary. So especially like somebody like me, I'm working on a computer 8-10 hours a day. And, by the time I get done, I don't feel like exercising. And I realize that through that, it's created a lifestyle of being unhealthy, right? Because we go from the house to the car to the office, back to the couch. I mean, there's not a lot of opportunity for movement, especially for people like me that maybe are working a lot.
Now sedentarism is considered worse factor than smoking tobacco.
Wow.
And causes many problems. So just by moving, we're reducing our health risks very, very much.
Well, I'm really looking forward to coming working, to working with you, actually to put some movement into my life. As soon as hopefully next week when we get back, we're going to be actually working together and on a constant basis. And if I can't force myself to do it by myself, it's great to have the encouragement of somebody like you to put me in and get me in the right direction and put that movement into my life. So
and as we age, it's harder to move. So if you have somebody there that knows what it's doing and encourages you to move, then you'll get results and you'll feel good. That's the idea.
Hello, we hope you enjoyed our video. And if you're planning on buying real estate in the Rosarito Beach area, please make sure to give us a call. Thank you very much.